Toronto's breaking news.
Brushing and flossing your teeth regularly is important to ensure good oral health. But what about fluoride? Joining us now with the natural approach to dental care are naturopathic Dr. Makoto Trotter and holistic dentist Dr. Christopher Tsang. Thanks for joining us, gentlemen. So what's the deal?
Thanks for having us, Nathan. And today we have Dr. Christopher Tsang here. He's a holistic dentist. We all grew up in grade school with those giant teeth and the giant toothbrush, so we're all familiar with dental health from a young age. We're going to talk about some of the more controversial issues about dental health, and we're going to start with fluoride. Now, fluoride is one of those things that's in our water supply, but the city of Waterloo, for example, removed fluoride in 2010, and most of Europe doesn't even use fluoride in their water supply. So, Dr. Tsang, can you tell us about what we know now about fluoride?
Well, actually, fluoride is and always has been listed in the Merck manual as a lethal poison in any toxicology reference textbook as well. Wow. There's actually enough fluoride in a tube of toothpaste to kill a small 20-pound child. Fluoride gets incorporated into our soft tissues, our bones, destroys the collagen, and actually makes things less elastic, less strong, and ends up getting brittle. So we end up with osteoporosis.
So that's a lot different than what we used to think about fluoride.
Yes.
Yeah. And then in terms of mercury, so this is a mercury filling. Mercury filling is those silver fillings. This is kind of what mercury looks like. And as an example, my grandfather back in the 1950s used to make mercury fillings, amalgams with his hands. Now there's a lot of different information these days about the toxicity of mercury. Can you speak to us about some of that?
Again, mercury is a known poison. It's lethal. It has no biological value to any living organism. Anytime the surface of a filling is stimulated, either with brushing or chewing or drilling, a lot of mercury vapor gets released from the surface. So these are some of the strategies that are used to reduce the amount of mercury vapor getting emitted from the surface. When the tooth's getting drilled out, this cleanup suction tip wraps right around the tooth, and this mercury vapor ionizer generates billions of negative ions across the room to absorb the mercury particles. And this mask can help dental personnel with reducing the amount that's inhaled.
So when you're getting mercury fillings removed, you want to make sure that some of this equipment is in your dentist's office.
Yes.
That's great. And so in terms of toothpaste, now conventional toothpaste have a lot of chemical ingredients. Most of them we can't pronounce. So when we're looking to avoid certain ingredients, what are the ones that are concerns? And when we're looking at natural toothpaste, what are some things that we're looking for?
All commercial conventional toothpaste contain fluoride and SLS, or sodium lauryl sulfate.
And that's an irritant for the gums, isn't it?
Yes. So all the natural toothpaste will contain soothing herbal ingredients, and that'll help to soothe and heal the gums, strengthen the teeth, strengthen the gums.
Perfect. Thanks so much, Chris, for joining me. We learned a lot today. And in terms of supplements, there are certain things that can help to strengthen your enamel and also your gingival health. So things like coenzyme Q10, vitamin D, vitamin K2, which is also in grass-fed meats and grass-fed butter, and green tea. Now, vitamin C helps as well, but make sure that it's not chewable because it's ascorbic acid and it actually can wear down some of the enamel. And make sure to talk to your doctor or dentist before making any changes to your health program. And here's a tip. If you aren't able to brush your teeth after a meal, the next best thing is rinsing those with water. What do you think of that, Nathan? Doesn't it make you just want to brush your teeth?
Or not want to brush my teeth. I'm not too sure. But great job as always, and we'll talk to you soon. Take care.
Thanks so much, Nathan.